Welcome to another episode of Follow the Brand TV. I am your host, Grant McGaugh, CEO of 5-Star BDM, a 5-star personal brand and business development company. I want to take you on a journey through another deep dive into the world of personal branding and business development using compelling personal stories, business conversations, and tips to improve your brand. By listening to the Follow the Brand TV series, you will differentiate yourself from the competition and build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build confidence, and reflect who you are. Building your 5-star personal brand is a great way to improve your skills and knowledge. If you have any questions for me or any of my guests, please email me at grant.mcgaugh@5starbdm.com. Now, let's begin with our next episode on the Follow the Brand TV. Tonight's guest, Dr. Erik Ilyayev, is the founder and former CEO of MyHouseVisit.com, which is an organization that provides medical home visits to the elderly and homebound. He founded the company right after he completed his residency at New York Presbyterian Brooklyn Methodist Hospital. His team of physicians, nurse practitioners, nurses, and care coordinators have serviced more than 5,000 patients in the New York metropolitan area. In March 2021, MyHouseVisit.com was acquired via a merger and acquisition by a venture-backed healthcare organization called Concerto Care. Dr. Ilyayev also served as the regional medical director of hospice for the Visiting Nurse Service of New York, which is the largest not-for-profit home and community-based healthcare organization in the nation. Being very passionate about medical education, he holds academic appointments as Associate Professor of Medicine in Touro College, St. George's Medical University, and is the Vice Director of Undergraduate Medical Education for Kingsbrook Jewish Medical Center. Seeing the complexity of chronic disease and the opportunity for optimized coordination of care, Dr. Ilyayev co-founded iConnect.io, a technology platform which currently delivers care coordination to physician practices nationally. One of Dr. Ilyayev's most rewarding roles in being a father to 6 beautiful children and spending time with his family. In his spare time, he produces music with his latest music video focusing on bringing awareness to substance abuse in teens, chains, having more than 200,000 views on Facebook. Here's a clip of the work Dr. Erik does for the physician community.
Hi everyone, and welcome back to iConnect University. My name is Dr. Erik, and I will be your professor for this course. Now, with this video, I'd like to give you a high-level overview of what is remote patient monitoring, also known as RPM. Let's get started. I want you to think about it this way. Traditionally, your patients would come to your office every 3 months or so. And every 3 months or so in that hypertensive patient, you would monitor their blood pressure in the office visit. And based on that data, you would then make a decision, and then you would adjust and titrate the medications. Sound familiar? Of course it does. We do it every day. Now, with technology, things are changing. And payers, such as Medicare, and insurance companies are saying, well, look, there's probably a better way to do this. How so? Well, what if I have a patient who every day in their home takes their blood pressure? Okay, and what if that information can come to the hands of the physician so that when the physician sees the patient, in the next visit, they don't have to just base their recommendations on that one visit. They can log into the patient's profile and be able to retrieve where their blood pressure was for the past month or so, and then make decisions. So you're going to say, wow, Dr. Erik, that sounds great, but I have so many questions. Who provides this technology? How does this technology work? How much does this technology cost? Who pays for this, right? And we're going to get into all of that information in our remote patient monitoring course.
Hello, everyone, and I want to introduce you to Dr. Erik. I call him affectionately Dr. Erik. It's Ilyayev, and I think I'm getting it right now how to pronounce his name. But I like Dr. Erik, Dr. E. One day he's going to have his own show. We're going to call him Dr. E. Dr. E. So he comes on live for the first time on the Follow the Brand TV. So I really, really like that. So, like to introduce yourself, Dr. Erik?
Hey, everyone. My name is Dr. Erik. I'm a physician by trade. Close to a decade of house calls in New York, delivering care to the elderly and the homebound, then started to do a lot of teaching to medical students, and then jumped into technology as well. Just love everything healthcare.
Well, you've been doing things for a number of years. Seemed like when you just got out of your residency. And I met you not too long ago. We were at a HIMSS function for golfing, right? And when that was for scholarships for kids. And we had a great conversation. We got to golf together, and we had a good conversation about the healthcare delivery system in the U.S. and the challenges that there are for physicians as they are as well for patients. Just someone interacting with the delivery system, it seems to be so challenging. So first of all, I'd like for you to talk to us about the two things that you're passionate about. And that seems to be in that RPM world, the remote patient monitoring, and then critical care, the critical care continuum, how you define that. So let's have a good discussion around those two areas. So you can start out with RPM. What is that, Dr. E?
Right. So remote patient monitoring, always like to start with a story because I think it can demonstrate the point really well. We had a patient who was an elderly lady who, she had a little bit of a high blood pressure, and we said, what, let's put you on a remote patient monitor. Well, what does that mean? Well, you come to the patient's home. We used to do house call visits back in New York, where I'm from. And you come to their home and you say, you know what, let's put in a device that has a 4G cloud connectivity. And that's important, right? Because you have to think about each point of the value stream. Think about a grandmother in her 90s. Is she on Facebook and Instagram and Wi-Fi at home? Maybe, but a good majority of them are not, right? So you have to think about it. Is Wi-Fi the solution for something like a remote patient monitoring? Or should you have something that's 4G and automatically connected to the cloud? So you give her a device, which is a blood pressure device or a pulse oximeter or a glucometer, anything really that can connect to the cloud. And we started monitoring her blood pressure. Blood pressure was okay, up, down, up, down. All of a sudden, one day we get an alert. Ding, 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 ding. Think about a command center. People are sitting there. They're monitoring all these vitals. You get an alert. Okay, blood pressure is 80/50. Wow, interesting. 80/50 in a lady in her 80s. What's going on? What's happening? Well, what should you do next? That triggers a call. Mrs. Smith, how are you? Any lightheadedness? Did anything change? Oh, yeah, I went to the cardiologist and he thought I had a few things like congestive heart failure. And he started me on this medication called the beta blocker. And that's where I'm at. Oh, so that's why your blood pressure is low. So that's why there's a possibility that when you get up and you get lightheaded, you're going to fall down, break a hip, end up in the emergency room, go through surgery, and God knows if you'll ever come out of it. So hold on a second, Mrs. Smith. Why don't we talk to your cardiologist? And if you really don't need that medication, let's hold it. That's exactly what we did. And think about one Mrs. Smith now lived her life without a fall, without hospitalizations, without any of that unnecessary surgeries, etc. But how many Mrs. Smiths are there in the world that we can help? How many things are we missing? how much leakage is there and waste in today's healthcare system. And these are all problems, challenges, yet they offer amazing opportunities to help people.
Man, that is great. First of all, that's a very realistic story. That is happening. I have my mother now is in her 80s. We just had this conversation. I mean, literally yesterday around what if. Now, she's married. My stepfather was there. They're there, but I said, you're not there around each other all the time. So if you did fall or anything like that nature, how, what would happen? How are you being monitored? Do you have some kind of alert or anything that can help? Now that's an event of a fall. I want to talk a little bit more about the remote patient monitoring, how people can even, get involved with, like, does that have to be prescribed by a physician? Can a person request it personally? Or how does that all work for people?
Right. So in order to be enrolled in a remote patient monitoring program, I was just at the atrium here giving a talk to a whole bunch of elderly folks. It was just the most sweetest thing ever. We had a talk, and I told them that you are your best advocates. You, the patient, your family members are the best advocates. So when you hear about these new technologies and you go to your doctor's office, you should tell your doctor, hey, doc, been having this blood pressure, and I know we've been going back and forth, and I've been bringing you my log book, but I've heard about something called RPM. Have you heard about this, doctor? Right? Engage them in the conversation too. You would think it would be the other way, where just the physicians are going to engage you, but not always, right? Physicians are overworked, overloaded, overstressed, over data driven, so much data coming in, nurses calling, pharmacists calling, hospitals calling, patients in the waiting room. It's called brain fried syndrome. So they may want to give you all the attention and all the information, but they just don't have the bandwidth a lot of the times. So you have to be your best advocate. You ask the physician, then the physician will say, hey, let me look that up. I've never heard of that. It could happen. They may say that. And you have to say, please, can you get me started on it? Because it could be the difference between life and death. I'll give you another quick example. 1 out of 3 people in the United States are at risk of getting a stroke, right? 800,000 people every year, 800,000. That's a big number, get a stroke. Now, Grant, you're going to ask me, okay, Dr. Erik, you're telling me the problem, but what causes the stroke? What's like the leading cause? And I teach my medical students, the leading cause of a stroke is hypertension. Wow. Think about it. Yeah. High blood pressure is the leading cause of a stroke. So imagine a world where you, Grant, myself, and everyone else is either connected via a watch or non-connected device monitors our vitals. And once it automatically detects that your blood pressure is 150, 160, 170, and by the way, you're not feeling it. You may have a little bit of a headache, but you don't even know you have it, right? It activates it. It notifies you. It notifies your doctor. And then your doctor's like, hold up, Grant, you're not in the good territory. Let me squash it before it goes to a problem. That's where real medicine is preventing things. So we focus so much on when you're actually sick. We throw so much, think about one hospital admission, $20,000 to $30,000, right? $20,000 to $30,000 of a stroke, and then rehab, and then physical therapy, and all the things that go with it. But what if we just connect everyone, identify who's at risk, and lower their BP? Very simple and effective.
We have to have that. You got to have that. You just said something, just so many people I know that recently just have either had a stroke or they passed away from a stroke. And they, like you said, the healthcare system, especially hospitals, they're in the critical care world. I mean, you have a major problem. That is where they get involved. But they're really not in the preventive care world. We're starting to hear this, value-based care models that are coming out. There will be more incentives for the healthcare industry as a whole to make sure that you have good health, that there's a monetary component fixed into that. And when you just mentioned RPM, which is remote patient monitoring, there is now a monetary component attached to that for physicians, especially if you've got patient populations and Medicare, right? So they can get a reimbursement. I know that was one of the reasons a lot of in the US started to adopt telehealth, because there was a reimbursement model that was on par with a physical visit. Talk to us about that component, that this change in value-based care as opposed to fee for service.
You've hit really all the right points, Grant, really all the right points. Medicare has a division called the CMMI, the Centers for Medicare and Medicaid Innovation. And they've been doing an amazing job in aligning the incentives. This happened throughout many different administrations. The Obama administration and all the following administrations really did a great job in working with CMMI. One of the really key people there who spearheaded value-based medicine was someone by the name of Adam Bowler from Landmark Health, and really did a good job in aligning the incentives. Really, to frame the conversation, you have two different worlds. You have the fee-for-service world, okay? And then you have the value-based medicine world. So let's start off where we've always been, the fee-for-service world. What does that mean? Well, Grant, let's say you're coming to my office, to Dr. Erik, for an appointment, right? And Dr. Erik is a fee-for-service physician. And let's pretend that, put a round number. Every time you come, you see me, I get $100, right? That's the number. Let's just throw it out there. So life is about incentives, right? And what is Dr. Erik thinking? Well, in order for me to cover my rent, my medical assistance, my overhead, and have something for myself to live on, right? I want to see as many grants as I could possibly see. So it's a volume game, right? But then if Grant calls me at 2 a.m., because I'm a 9-to-5 doctor, and I only get paid when Grant sees me in my office, $100. Grant calls me at 2 a.m. and I'm with my family. I mean, I love Grant. I love you, man. But like, I don't have the resources to tell you what to do and to come to your home. And if you need me to take care of you and to talk to your pharmacy at 2 o'clock in the morning, because I'm incentivized to get paid when I see you in my office. So what's my natural reaction? You call me at 2 a.m. Grant, I understand you're having these issues, but there's nothing I could do at this time. I would highly recommend you should go to the emergency room and have them take a look at you, because although there's urgent care and the hype about urgent care, most urgent cares are not open 24/7. So I'm going to send you to an emergency room where you're going to get charged $3,000 to $4,000 for something that's probably simple, and they'll send you home with something simple, right? Makes sense. Now, so that's the pendulum. The pendulum was right there. Now the pendulum is swinging the other direction. Which direction? Well, CMS comes to Dr. Erik. And again, I'm just going to throw any number out there. And it says, Dr. Erik, we're going to give you $12,000 a year to manage grant. So if you have 10 grants in your office, you get $120,000, right? And do the math. If you have 100, you get $1.2 million, if I'm doing the right math. Great. Okay. But Dr. Erik, there's a catch. What's the catch? Because life is not that easy. Well, you're responsible for those dollars. The more you spend, Dr. Erik, the less you have left in that $12,000. So if Grant calls you at night for something simple that you could say, hey, Grant, no worries. I think it's a UTI. I'm going to, at 2 o'clock in the morning right now, prescribe some antibiotics to your pharmacy, to a local Walgreens that's open 24/7. Please go pick it up and you'll be okay. I could do that, and then I don't have to send you to the ER, which is going to charge you and the insurance, meaning me now, because I'm responsible for that $12K, $3,000. So it's now the pendulum goes where the doctor now is really caring about those dollars spent. As you know, though, and in Maimonides is a famous Jewish doctor and scholar and rabbi, and he had this beautiful thing where he said, never be too much to the left. And we've talked about this in the past. Never be too much to the right in life. Yeah. The middle road is the best. So when you talk about fee for service and value-based pendulum, to the right, too much value-based, no good. Too much fee-for-service, no good. You're going to say, wait, Dr. Erik, why isn't too much value-based good? I mean, what you described is great. Let me paint another scenario. Grant, you come to, well, I don't want to use Grant. I'm going to use Charlie. Charlie comes to me, and Charlie says, Doc, man, I've been having crazy back pain. Can we check that out? I say, well, let's get some physical therapy. It's probably nothing. You probably sprained it doing the yard. Okay. You come back. I still have pain. Now I'm thinking, if I send Grant for an MRI, that MRI is very expensive. It's $1,000. And where does that come out from, Grant, in the value-based medicine world?
Yeah, that's going to come out of your incentive, correct? Right.
So then we're entrusting, and it's so hard because there are amazing doctors and great human beings, and then there's players who are not the greatest apples in the field, right? So then we're entrusting that the doctor will really have his incentive of what's best for you and not what's best for them. Now and there are many great doctors, but that leaves an avenue open for some of the bad players that will say, you don't need that MRI, man. Just get an X-ray. It's probably nothing. You don't need to get it worked up, because every time I work you up, I'm decreasing in my bank account, right? So I gave you an extreme. Most doctors are not like that. They're amazing. Most clinicians, nurse practitioners, they're amazing. But it is a possibility that we should have protocols and keep in mind.
You explained something to me that I just didn't get that picture. I understood the incentives around fee for service. I understood the why around value-based care. Right? You just explained to me something like, you know what? It's a pool of money in that we call it VBR, where you have a pool, and the less you use of it, the more you get to keep. The more you use of it, the less you get to keep. So again, it's incentive based, and you have to understand these incentives and why things are the way they are. That was excellent. So there was the other thing. Now, we've talked about remote patient monitoring. Talk to me about, especially, and talk to us from the physician and the patient perspective when it comes to that critical care continuum. I think you call it CCR or something to that effect. Help us understand.
Chronic care management.
There you go. Chronic care management. Yes.
Yeah, chronic care management is super, super important. What is chronic care management? In a typical doctor's visit, you spend 1 to 2 hours in a waiting room a lot of the times, and then 15 to 20 minutes in a doctor's office, actually, right? That's just a lot of the times, that's the drill, right? Volume, fee for service. But think about how many things a person with chronic care conditions has that you can't address within those 15 minutes. Think about something as simple as social determinants of health, like simple things like getting the right food, making it to your appointments, having transportation to make it to that appointment that's critical to your health. Isolation in the senior population, social isolation. Can you really take care of those things in 15 minutes? The doctor is busy enough documenting in his EHR and dealing with 20 medications. Does he have really the time to focus on those? No. So CMMI and Medicare and CMS, they came out with something called CCM. It's a great, great product. I call it a product because there's a lot of these products that came out. It's a service that Medicare says to doctors and other insurances, look, have your clinical team call your patients once a month for a collective 20 minutes. It doesn't mean 20 minutes on the phone. It means you could do 5 minutes a week, right? and just check in. So for example, your mother, Grant, I'm going to have my team, Samantha on my team, call your mom and say, Mrs. Grant, let me ask you something. How are you feeling? And go through certain standardized questions. One of which, for example, is, have you been having any burning when you urinate? Simple question that some people wouldn't even tell their doctor. They'll forget about it. But imagine we call your mom and your mom says, you know what, Samantha, actually for the past 3 days, I've been feeling a little bit of those symptoms. And then Samantha says, well, before it gets into UTI and sepsis and craziness, let me speak to Dr. Erik about that and maybe bring you into an appointment or make a telemedicine visit so that Dr. Erik can address that tomorrow. Dr. Erik gets on the phone. Mrs. Grant, how are you? Oh, wow, you do? Let me call in an antibiotic to your pharmacy. Boom. Now, what does CMS and Medicare say to Dr. Erik? Dr. Erik, we're going to reimburse you for that. If you do that and you focus on quality of care, we're going to reimburse you for that. So don't just think, Dr. Erik, about the more patients I see, the more revenue I generate. Think about the things around that, like CCM, RPM, TCM, RTM. There's all these different things out there for physicians and patients.
I tell you, Dr. Erik, this is wonderful. I'm hearing things that are changing on both sides of that ball. From the physician experience, you talked about something that's super important these days, and that's physician burnout. People are leaving that profession. It's just overload. And then you talked about the patients. Now, remember, when I say patients, I'm talking about population. We've got we call the gray tsunami that is taking place in the United States, meaning we've got an elderly population, the largest elderly population probably ever in the US at one time. There's 5 generations right now in the workforce, believe it or not. It's a lot of different people. And as like anything else, the longer that you hold on to it, the more depreciated, let's just say, it gets. This is the point. And here's the thing that really got me. I've been relatively healthy most of my life, but now I'm getting to a point now where I actually might need to use my healthcare insurance. I'm going to start having those problems that I did not have, 10, 20, 30 years ago. And now they're starting to come up. And now I have to use this great, healthcare system that we have here in the US with no idea what I'm about to embark on or get involved in. And it's going to be eye-opening, I think, for a lot of different people understanding what's covered, what's not covered, what you need. So help us frame that story around from the perspective, first from physician burnout, and then talk to us about some of the policies that are taking place that may or may not help, and maybe you even have some ideas to make things a little bit easier for our physician world, and then again for this tsunami that's happening as the patient experience is just getting revved up. What do you think about that?
Yeah, you've hit all the right points again, Grant. The silver tsunami, as they call it, is real. There's going to be a shortage of physicians, a shortage of practitioners, caretakers to take care of the elderly population and tsunami that's coming. And really what's important is I always think about medical education as one thing. Now, think about it. 4 years of college, 4 years of med school, that's 8, and at least 3 years of residency. That's 11 years to become a physician, an internal medicine physician. Now, if you want to add on cardiology, gastroenterology, and other type of specialties, you're adding on another 3, 4, 5, 6 years on top of that. So that's one reason why we have a shortage of physicians, is because it's taking so long to become a physician, right? So people are looking at the opportunity cost and saying, well, if a nurse practitioner can do it in such a shorter amount of time and essentially function really well, why should I have to spend so much time? That's number one. Number two, if you think about the medical education itself, it's lagging behind the policies that are happening right now. So medical education is still in the old school. They're still teaching fee-for-service. They're still teaching the old system of healthcare, while we're already navigating towards value-based medicine, technology, clinical decision support, AI. So there needs to be a restructuring of medical education, both the time it takes to become a physician and also the actual studies. Look, I have nothing against inorganic chemistry. I think it's important. I have nothing around organic chemistry. I think it's important. But the truth is, and it's kind of like a filter maybe and a weeding out system, but how much am I using organic chemistry in my practice as a physician? Zero. What if instead you taught me about leadership in medicine, healthcare, MBA, policy, unit economics, right? All of those things you spent time and you taught me. Now I'm coming out both as a physician, but also now I understand the whole dynamic of healthcare, right? I feel that's really important, and that's missing when it comes to physician burnout. And physicians come out today and they get burnt out because they feel like they're not involved in the decision making. You know, if you have a chef who knows how to make the best pizza, and you're opening up a restaurant that's new and you want to make delicious pizza, you should involve that chef in the decision making, so he can also contribute his knowledge. But we have a whole bunch of pizza stores out there with pizzas that don't taste good because the chefs, the physicians, are not involved. Now it's getting better. Thankfully, physicians are getting involved more and more. But I think that's the opportunity. That's the real opportunity.
Well, those are all important points. You touched on a lot there from physician experience, what's happening, how we've got to make some adjustments. And I know you've got some things that you've been working on from your own, because you're an entrepreneur as well. So we're going to take a short break, and then we're going to come back. We're going to talk about some of the things that have empowered you, that you're passionate about, that you've been involved in for a number of years, and then have that discussion and see how we can solve some of these issues. How about that?
Sounds like a plan.
I started Gateway Healthcare Solutions to help medical facilities to improve their financial performance. GHS has a healthcare denial prevention strategist practice designed to improve healthcare financial services, offering denial management and business development with a strategic approach of mechanisms for hospitals, clinics, and providers on how to maximize payer contractual agreements.
We are a growing firm with a demonstrated record of success with our client projects by leveraging our wide-ranging skills and expertise to assist with delivering high-quality services such as denial management, revenue cycle management, strategy consulting, management training, medical software, and contract management. Our approach offers an analysis of your current state coupled with a proven solution and execute with a process improvement strategy and implementation methodology for our clients.
GSS develops an understanding of its customers' problems by identifying, assessing, and tailoring the services to suit the business needs. Selecting the right healthcare solutions advisor can bring you the management services you need and peace of mind you deserve.
Call us today for a free consultation.
Follow the Brand TV broadcast host, Grant McGaugh, as he visits with top executives and entrepreneurs to find out their secrets of success with their personal brand. Follow the Brand TV broadcast host as he focuses on brand development to build better relationships, bring value to your business, relationships, and career. You will enjoy listening to each episode that is tailored to speak to you directly. If you're looking for this type of clarity in terms of building your brand, you have tuned into the right station. Each episode will help you to shape a conversation in the 5-star BDM network of 20,000 professionals and become a springboard for your corporate engagement and business opportunities. Each guest will frame their story in the areas of personal branding, business development, career development, financial empowerment, and technology innovation. Grant McGaugh explains why he is the CEO and owner of his own professional career. Grant is an accomplished business leader and entrepreneur who wants to give back to individuals to grow their personal brand strategy. Tune in as he weaves his story about new possibilities, while to you exceed expectations. If you love storytelling, this show will make for fun.
I'm glad everybody is tuning in. I hope you just enjoyed the commercial set we just had. In our first half, talking to Dr. Erik, we're going to switch the conversation. And we're going to talk about Dr. Erik from an entrepreneurial standpoint. He's owned a company, he's sold a company, and he started a new company. And that is a heck of a journey. So I want to ask Dr. Erik, first of all, what got him, even thinking about opening a company, and how, you got to a point of success, and then you sold it, and then you pivoted to another company. Talk to us about that experience.
Yeah, it was an amazing experience. I mean, founding a company, my first company was called myhousevisit.com. And I started it 10 years ago, and we delivered house calls to the elderly and homebound. Started myself. And then I said, look, I could only do so much within the 8-9 hours of the day. And then I started hiring other people. And that was a process too, because when you're hiring and training other people, you're thinking, well, how can I scale the training? So I developed something called My House Visit University. I took a chapter out of the McDonald's book, where it was a university. It was an online video on-demand university, which taught nurse practitioners, physician assistants, doctors, how we deliver care at My House Visit. And it was standardized and it was scalable because it was on demand. And then I grew it. I mean, it was really about the mission. The mission was to deliver value and satisfaction in every interaction, right? And I wanted, from the phone picking up to the knocking on the door, to there to be value and satisfaction for the end customer. Did that, then started gaining interest from value-based organizations that said, hey, you have this large house call group. We're interested in merging and acquiring you. And I said, that's great. And then I started learning. This is continuous learning. Okay, well, what's a merger and acquisition? How do you get that done, right? And how do you evaluate a company? What is EBITDA? What are multiples? And you start working on yourself, right? And Charlie Munger says, try to go to sleep a little bit wiser every night than when you wake up in the morning. And so that's what I was doing. And then I said, well, you know what? I love technology. I love technology because I can reach so many people. And myself and my co-founder Ahmad, we founded a company called iConnect, IKONNECT.io. And that's really a chronic care management and a remote patient monitoring company, some of which we've talked about today. And iConnect really focuses on two consumers. Number one are doctors. We want to help doctors. We're a platform that helps doctors perform CCM and RPM, right? So they have a platform. There's certain requirements, medical requirements, technology requirements. It can get overwhelming. We come to the doctors, we say, we have a turnkey solution, which is a compliance solution from the time you engage your patient to the time you're doing your billing, both for CCM and RPM. And at the same time, our consumer is the patient, because we're patient advocates. We want to develop that platform that will have those tools for patients that we've talked about, the phone calls, the check-ins, the remote patient monitoring, the technology. So for the remote patient monitoring, we've partnered with an amazing company called Life Care USA. And Perry Aviton is just is an amazing, amazing CEO, and we've partnered on that with Life Care USA. And it's done really, really great things. That story I told you about, the lady, the patient of mine, right, who had the low blood pressure. Can you imagine at scale, at 5, 10, 20, 30,000 people's lives having that impact? And that's what iConnect strives for. We're like a sales force. We have CCM, RPM, behavioral health. We're integrating with other services so that there's less fragmentation, that you don't have to go to 17 different platforms to get all of your services. You just go to one, to iConnect.io.
That is, first, I love the vision, and I see the need. And it sounds to me like you got out of school. I mean, you did the first venture right out of your residency. You saw that here's the gap. Here is a gap. And now you instituted some technology as a part of that. So you're not only a physician, you obviously understand medicine and the application of medicine. You understand the human experience. And you are seeing the technological platform as a game changer, and how we can impact care. Because I definitely would want that. My loved ones, I would want that. Like, how can we do more with less? One thing I learned about technology, I've been in technology for 20, 25 years, is that what technology is really good at, what they're really good at is two things. And what is that? Number one, communication. Very, very good at communication in real time. Very, very, very good at that. And the other thing has to do with time as well. And that's the collapsing the window of time, right? It's the speed at which something occurs can be collapsed through different technologies. So when you're in a critical care setting, anyone that works in a hospital understands that time is of the essence. It's the time that it takes to get you into the OR, if that is what it is, or you've got an emergency, or to get, connected to the care that's important for you. Time is of the essence. So if you can communicate effectively through real-time alerts, something that communicates to someone else that can then bring two entities together to prevent a negative outcome, you can have a more positive outcome, and you can collapse that window of time. I love how you talked about, hey, if we can get ahead of someone maybe possibly going into a stroke episode, how important is that? And then the other thing we need to talk about is that in the U.S., from the economy standpoint, is that healthcare, I think it's around a $2 trillion or something like that. And it represents around 18 to 20% or so of the overall U.S. government budget. And that's only going up, not down. So if we continue doing the same thing that we've always done with this new silver tsunami that's taking place, that would bankrupt the system. It's going to be overrun. We saw with COVID, how COVID, occurred. We saw the gaps, especially in our at-risk populations. Who's more vulnerable to coming down with a life-impacting disease? And then what do we have in place to detect that disease and mitigate it? And then we started to realize, hey, we can utilize at least technology from a telehealth perspective. That's how we can have this doctor that one to many we can have, because sitting out, I hated this, still hate it. You set an appointment for a doctor, it's months out, you probably almost forgot about it, but then you probably get some kind of alert of some type, hey, you got an appointment. Then you go, you take the time, you probably take a half a day, take time off work, you go to the appointment, you get there, you still got to fill out all this information. You sit there for another 20 to 30 minutes, and then they finally see you. He sees you for like 10, 15 minutes, and then you go on, you check out and got you on your way. Like, wow, can you collapse that window of time? I say you probably could.
You could. You're 100% correct. as they say, like you mentioned, we can't do the same thing over and over again. That's insanity, right? The definition of insanity by Albert Einstein is doing the same thing over and over again and expecting a different result. And then another nice saying is that necessity is the mother of innovation and invention. So we're going in that direction. We really are. And we are beginning to innovate. And I think it's exciting times. I think it's very exciting times that
Let me ask you from a payer perspective. We haven't really talked about the insurance world because you're an entrepreneur. You've got a technology. You are impacting the patient experience. You should be saving the dollars that the insurance company would normally have to pay out. Is the insurance company reaching out to companies like yours to get them involved, and then so that the pay structure would be different? Help us understand that model.
Yes. So there's a couple of different tracks. One is the value-based track that we talked about. The other is that insurers have realized that in order to align all the incentives, they may have to become insurers/providers. So a lot of the insurance companies, right, like United, and they bought Optum, and so you see a lot of this where insurers are saying, well, we have to control the risk, we have to control the cost, and a lot of the times we can do that by actually also providing the care, and also by having technology companies either doing JVs with technology or flat out acquiring technology companies, and they're implementing their proprietary technologies into the insurance companies, into their provider network, and into their patient network. So that's definitely happening. You're 100%
I love to hear
correct.
that. So there's light at the end of the tunnel as we start to really look at this as a collaboration between all the players in this ecosystem that we have to get involved in. I think that's very important. So
I'll tell you who will have to evolve, and just making a prediction. And a lot of these entities are starting to move, but not as fast as they should. Are hospitals, Grant? Hospitals right now are in the acute care model of care. That's their business, right? Think about how IBM and other companies, they've evolved, right? They were in one line of business. And like Oprah says, if you don't evolve, you dissolve, right? If you don't evolve, you dissolve. And so hospitals are going to need to, and some of them are starting to do that. The big players like the Northwell Healths and the Memorials, and really the big ones, are starting to do this, and they're starting to enter the chronic care world. They're understanding that as things shift from the hospital to the home, the hospital will not be able to survive financially unless they're part of that play of delivering care to your home and chronic care and not letting you come to the hospital. And you'll see that, like Kaiser Permanente, I think, which is a large health system, they lost you can look it up, about I think $1 billion. It just came out.
I saw that. Yeah, you're right. Wow, that's not small amount of money. They're losing money, and because it's changing, the landscape is changing, the models.
That's Kaiser.
Yeah,
that's Kaiser. So there's going to be a lot of interesting things, but ultimately I think we're moving in the right direction. We really are.
Well, I like your optimism. We're going to take a break, and then we're going to come back from break, and we're going to talk about some things that me and you are working on mutually. How about that?
Sounds like a plan.
I am Black business. From the moment I wake until the time I sleep, I am Black business. I am Black business. Are you Black business? I am Black business. Do you support Black businesses? I support Black business because I am Black business. Black Business Expo, one of the largest business showcases in the history of Black business in the world. Sign up today at www.blackbusinessexpousa.com. or call 919-308-9090. I am Black Business.
The Black Business Expo's mission is to raise funds for high school seniors going to college or K through 12 entrepreneurs. This expo is a fundraiser for students. Please, you may go to www.blackbusinessexpousa.com to donate to the scholarship fund or use the Cash App at $BBXUSA. Our goal is to give laptops and up to $5,000 to 10 students. Students can register online at www.blackbusinessexpousa.com. Every dollar counts. Please donate to the Black Business Expo USA Scholarship Fund.
Five-Star BDM, Brand Development Masters, is a professional consulting and advisory group keenly focused on business development services for the small to mid-sized business and entrepreneurs. Although every business is unique, they often share business development challenges that can be addressed through smart branding. Services include process improvement and operations, digital strategy and transformation, business intelligence, digital marketing, and personal branding. Our business and personal branding company has helped a number of professionals and organizations to optimize and grow. This results in more business, more opportunities, better reach, positive outcomes. Visit www.fivestarbdm.com today to learn more.
This has been a phenomenal conversation with you, Dr. Erik. And we work together. We work through HIMSS. And HIMSS is a phenomenal network of about 100,000 different people throughout the world. It stands for Health Informatics Systems Society, or I think Health Informatics Management Systems Society. You got to get the M in there, right? And we're going to be doing a program in September 22nd on AgeTech, in which you're going to be the moderator and the keynote for that particular discussion around the aging population and technology. Tell us a little bit more how you feel about AgeTech.
Yeah, AgeTech is amazing. AgeTech is pretty much focusing on technology that is built around older adults, their family members. And I remember you and I and the HIMSS team were talking, and we said, look, we should get all people in the room who are involved in developing these technologies and just have like a dish of all these rice and all these components of all these people in the room talking about AgeTech and the revolution that's coming in AgeTech. And like, picture this, like, we're not there yet, but we will be. Picture your mom is living in a house, and that house is a smart home. Every step she takes, it counts. What time she gets out of the bed, it notices. What her pull socks is, it notices. The amount of food that she eats, it calculates the nutrients. Now, you think this is all Star Trek. Remember Star Trek back in the day where you could see people on the screen and talk, and we thought, wow, that's impossible, and now we do that on our phones? That's AgeTech. That will be the world. And all of that data from your mom will then go to the cloud, and there will be something called, as we know now, clinical decision support systems. These systems that are using algorithms, and they're looking at your mom's labs, and it's looking about why she's sleeping longer. Maybe she has anemia, and maybe she's taking a blood thinner medication that's causing her to bleed out, God forbid, and that's what's going on. And it's sending an alert to the doctor. Hey, doctor, based on all these data points, we think these are the top 5 things. I'm going way into the future. Maybe 5, 10 to 20 years into the future, but we are planting the seeds with AgeTech into that picture that I described. That will be the reality for my grandchildren, 100%. That's where they will be living, in that world. And it's going to be a beautiful world, a very beautiful world for patients.
Cannot wait to see that. Maybe that'll be for me, that's going to be my experience when I'm in my 70s and 80s. And my kids or my care team, right, are getting these alerts, and then there's security obviously going to be involved in that, and that you can get the kind of care that you need, so you can have a productive life, right? Hopefully we get to that nice golden age of our time, but you want it to be a happy time, right?
100%. And we have some of those components now, but they're all over, they're spread out. Now, remember how like the iPhone, before Steve Jobs put it all together, there was the screen, there was the speakers. So he stacked all of those things together into one. That's what we're doing with our AgeTech conference, right? We know everything exists. We know that there's a medication bottle with a pill, with a cap, that when your mom, every time she opens it, it sends through Bluetooth to the cloud saying your mom took that medication today. That exists, but it's not integrated into a wider system where that information goes to the doctor, to the insurance company, right? Think about this. How many, I did house calls, and I went in and I said, ma'am, can you show me where your medications are? And they would open up a closet, and there would be bags and bags of medications that they would not take. They wouldn't take, they would just put them. So what happens there, Grant? There was waste, because the insurance is being charged by the pharmacy. The patient is not taking them. Some of these medications are $500, $600, $700 a month. Do that at scale, and they're in the closet, and then they go to the garbage. We'll have that technology to monitor whether or not mom's taking that med or not taking, and then send the signal to the doctor to have that conversation. And the insurance company will actually see that and be like, hey, why are we paying for this medication if no one's taking it? That will be the world of AgeTech, of efficiencies for the elderly, for everyone. I'm excited about it. And HIMSS and the job that you are doing within the organization, and we're working together, is really planting the seeds for that and connecting everything.
Well, we're going to have a fantastic event. That's going to be on September 22nd at FIU. That's Florida International University. And we're going to have doctors there, we're going to have physicians there, we're going to have technologists there, and we're going to have this conversation now because I think it's very, very important. So, Dr. Erik, if the audience would like to get in touch with you, what is the best way?
Sure, you can look me up at either LinkedIn, that's the easiest, Erik Ilyayev, ErikILyayev. That's really the best way. Or you can go to our website at iConnect, IKONNECT.io if you're interested in learning about CCM, RPM, and other such services.
Well, this has been wonderful. I'm definitely going to your website again so I can get up to speed in everything that we just talked about. And I would tell my audience, if they want to get in touch with me, definitely go to www.5starbdm. That's B for brand, D for development, infomasters.com. Thank you so much for being on the show tonight.
Grant, thank you. It was an honor and a pleasure to get a spot on your show. I am really blessed and honored. Thank you.
You're most welcome. Hey everyone, it's Grant McGaugh, CEO of 5-Star BDM and host of the award-winning Follow the Brand podcast and TV series, where I help you to build a 5-star brand that people will follow. My genius is personal brand development through intelligent communication and helping you achieve your business and career goals. I am a requested speaker on digital technology and brand development issues. I want to work with you to increase the value of your current opportunities while attracting new ones. Every one of you is unique, and we all share challenges that can be addressed through smart branding. As a superconnector, I work with you as an executive coach to guide you along the complicated business and career development road, providing the enhancement tools and information you need to succeed. Together, I will help you succeed in today's challenging business climate. I will evaluate and measure your progress. Best of all, I am right alongside you every step of the way. Build the brand called you. Genius.